Hi, class. Welcome to week 4 of clinical psychology. This week, we are going to be looking a little more into different psychotherapy options for treatment and how do we know what is a sound ethical therapeutic intervention for a patient? How do we select that or collaborate with the patient on that? What are the factors in that relationship or that therapeutic alliance that help us have more success long term with a patient for those that are in long term treatment? How do we know that we're following really sound ethical principles and ethical codes that guide us in our practice? So we'll be doing an overview of some of the different umbrellas or types of treatment for therapy, individual, group, short-term, long-term, and how different presentations or settings may offer those and what interventions and approaches might be aligned within those categories. So with that, your discussion this week will be taking a look at what are these ethical considerations. Are you are you beginning to better understand, if you didn't already, what some of our ethical principles are and the American Psychological Association ethical codes? You'll be answering some questions about ethics, how we know we're following the strongest ethics in our clinical work, and what does it mean to have an evidence-based approach or intervention? How do we know if what we're selecting is evidence-based? When is it appropriate to call it that and suggest that it's that with our patients? And you'll be answering some questions about that in your discussion. You'll also this week be providing a video, again pretending you're a supervisor of an intern or trainee new to psychology, giving them the basics and fundamentals about what motivational interviewing is. What are some of the core techniques and skills? What are the origins or history of the development of motivational interviewing and the settings it's been utilized for and most found to be efficacious for? What are these stages of change you'll hear about a lot with this trans theoretical model that motivational interviewing operates with and aligns with. And hopefully in your learning of motivational interviewing, you'll also begin to understand how adaptive and useful this intervention and strategy can be, and how it can be paired with many other types of psychotherapy interventions. I often lean on some of the motivational interviewing skills in my work with veterans clinically. And this presentation will be a short video, including at least 2 clinical resources to help support your claims in that video. So make sure you reference those. And then your other assignment, which is nice here this week, is that you can select or choose, what format you'd like that to be in, whether you'd like it to be a PowerPoint presentation with voiceover, video, or paper. It's up to you. Just follow the guidelines there for how to make sure you're submitting enough material. And please follow the questions that are listed there for that. And in this assignment, you will be doing your best to provide some of the advantages and disadvantages of short-term therapy, long-term therapy, individual therapy, and group therapy. Some of the similarities and differences will probably become apparent as you complete this assignment as well. And for this one, there is some review of this in the text, but we're hoping that you can also integrate other ethical literature and resources to help support your claims with this. Pull up some recent or relevant literature to help you describe this more thoroughly. What settings we're utilizing these for, and what are advantages and disadvantages of them. There really are pros and cons of all of those different types of treatments, and sometimes the certain mental health conditions or other aspects of the individual's functioning and abilities, motivations, background, all those factors come into play as we collaborate on treatment plans and interventions with our patients. But what helps us determine what might be better suited for what settings and conditions. I hope you enjoy that. And again, this is sort of part 1 this week of assessment, and next we will be, part 1 of psychotherapy. And next week we'll be moving into more varied learning about varied and different approaches to psychotherapy in this course. Please don't hesitate to reach out with any questions that might come up about the material or the assignments. You can always email me at my email address, comorris@baypath.edu. And again, I can make myself available via Zoom or by phone if that would be helpful too. Please stay on top of the work. This is such a short course, only 6 weeks. So if we get behind, it can become a snowball effect and become difficult to get back on track. And please give me a heads up if you might need to be late with something. There is a 4-day window, but there will be points deducted for lateness. And reminder, weeks 1 and week 6, there cannot be any late work submitted for credit. We are already over the midway point. We're entering week 4. I wish you the best with your learning this week, and I will be posting a video next week as well. Thank you. Bye-bye.